Earlier this morning, we unveiled a diagram that was created by ranking Republicans showing what they say is the nightmare of the Democratic health reform plan. Here to help make sense of this health insurance health insurance broker, Craig Gussin. But first, we're going to show you the chart here. And as you can see, or are about to see, it's very convoluted. And there we go. This is just the computer of the chart there. If we could take the actual full graphic there. It's, a lot of people are very confused. And if you're confused, well, you're not alone. Craig?
I'm confused.
Looking at this chart, let's explain it very clearly here. First of all, we have everything in white, and this is everything that is basically already in place with our current health care system. Is that right?
That's my understanding from how I read it.
What's all the other stuff? And look at all the arrows, and how is anybody supposed to make any sense out of this? It's $1.5 trillion that is going to go to help provide insurance to the 50 million Americans who don't have it. And people are looking at this, and it makes you dizzy.
When I first saw it, too, I looked at it and I thought maybe it was a solution to cover everybody who's unemployed. But I realized, it wasn't. So when I looked at it, I did some research. I found out that this is going to create 31 new federal programs, agencies, commissions, and mandates. So everything that's not in white, my belief is that it is going to be something new. So if I was trying to figure out where we start with this, and I was going to start with us as a consumer.
Okay, here we are. Us
so we
as
got
the consumer.
We work it down and we say, okay, the consumer gets health insurance from the employer, hopefully. The employer is going to end up paying tax on that money because it's going to be a taxable event. And also the employees are going to pay tax on the money that they get.
Okay.
So then we're going to go across, and the money that gets to the IRS is going to go to the Treasury Department. The Treasury Department is going to take that money, and they're either going to put it in the trust exchange fund or in the public health fund. So this is money for the public to cover Medicaid, Healthy Families, Medicare, and all the public programs that they're going to do.
Now, looking at this, this new infrastructure that is, it's a plan. It hasn't been approved yet, but many people think that something similar will be. This just means more red tape, more government agencies, more confusion. And what about the money?
The first thing I looked at when I saw this is, here's your $1.6 trillion issue. Right. Because everything that's not in white is going to cost money. So they're going to have to hire people to be in every department, and I got to a point where it's like, how are they going to pay for this? So I think a lot of the $1.6 trillion is going to go to put all this together.
And hospitals are coming out and saying that the quality of care is not going to be the same. It's by revamping this, it's not going to be health care as usual in America. In fact, it's going to be so overhauled, some people might not even recognize it.
Exactly. I heard Congressman Isaac today talk on his show. And it's going to change everything. The one thing I found was interesting, if you look at the whole chart, here's private health insurance, and here's the government. And I think that's one of the biggest issues. In the United States, the people that do it the best are the private industries.
Because the focus is on quality of care.
Quality of care, how to do it at the least expensive price. You look at all of this and you're going, how are you going to pay for, like you said, how are you going to pay for all this? And that's the biggest issue, the quality of care. They're going to get to a point where we're going to say, we can't afford this because we just spent $1.6 trillion on all of this. So, Sandra, we can't afford for you to have this surgery and we pay for it. We're going to have to do something else. Maybe you can do it, but you can do it in 6 months now because there's a waiting list. And that's a concern we have. We're going to end up being like Canada and every other country with a government program.
Well, let me ask you, for the people who can afford health insurance and the Americans who do have health insurance and pay for it, will the quality of care change for them?
Yes, because right now 85% of the population has health insurance. The 15% who don't, the moment they get it, they'll be going to the doctor every time you turn around. And every one of my clients who has a $10 copay and everything's covered, they go to the doctor all the time. The ones that say, you know what, I don't go that often, give me a high deductible plan, they don't go that often. So what happens is when it's very inexpensive for free, in some cases, they're going to go to the doctor a lot. We do not have enough doctors in the United States, primary care doctors, to cover everybody out there. Think about the last time we had a flu epidemic and anybody tried to go to the doctor. They're going, we'll book today, we'll book this week, we'll book next week. That's what our life will be the rest of our lives. And most people can usually get into a doctor within a couple of days. I mean, even today, in an emergency, normally you can get in that day. The ERs are going to be incredibly packed. Everything is. So it's going to end up being more expensive. not less expensive.
So this is just the blueprint of things right now. It will be tweaked, obviously.
Major.
Before it will be. So this is going to hopefully look a lot different the next time we meet.
It's going to have to, because you look at this, and I don't think anybody understands this, even the government, and all they're doing is creating more and more bureaucracy, which we can't afford.
Craig Gussin, a health insurance broker, thanks for trying to explain this
My
anyway.
pleasure.
I feel like I understand it a little more.
Me too.
Appreciate your time this morning.